5 tips why medicinal cannabis helps with HIV and AIDS. Tens of millions of people have died from AIDS since the 1980s, and the immune disease, and HIV, the virus that causes AIDS, still causes a lot of trouble. Fortunately, cannabis is a proven effective medicine. 5 reasons why, with scientific substantiation. HIV and AIDS. HIV/AIDS identifies a number of conditions caused by the human immunodeficiency virus, HIV. Approximately 35 million people worldwide are infected with HIV, and since the 1980s AIDS has caused around 36 million deaths. Science has shown in recent years that cannabis is exceptionally effective in the treatment of various symptoms of HIV/AIDS, acquired immune deficiency syndrome. Appetite stimulating. A 2005 survey of 523 HIV-positive patients showed that 143 respondents, 27%, had their symptoms with cannabis under control. An overwhelming majority of this group, 97%, reported that their appetite improved. In 2007, a double-blind study was conducted into the effects of smoked cannabis and dronabinol. Dronabinol is a synthetic form of THC. This study showed that both cannabis and dronabinol increased the caloric intake in a dose-dependent manner compared with a placebo. The effect was characterized by an increase in the number of eating moments. Although everyone ate an average of 404 kilocalories during a meal, the distribution of nutrient intake changed significantly due to cannabis and dronabinol. When a patient received the placebo, he collected 51% of his nutrients from carbohydrates, 36% from fat and 13% from proteins. When he received dronabinol, fat consumption increased to 40%, while the consumption of carbohydrates decreased. When he received cannabis, protein consumption dropped to 11%, while fat consumption usually increased. When a high dose of cannabis and dronabinol were administered, the body weight of the patient increased considerably. When using a placebo, the average weight of the subjects was 77.5 kilograms. After 4 days of cannabis, the patients had arrived 1.1 kilograms, and after 4 days of dronabinol 1.2 kilograms. Nausea inhibiting. Nausea is a common symptom of HIV infection, and with the progress of the disease, the causes of nausea can become increasingly complex. Nausea can be caused by problems in the gastrointestinal tract, a hepatorenal disorder, a disorder of the central nervous system, or by treatment of the disease. It is well known that cannabinoids and certain similar synthetic substances can counteract the symptoms of nausea in HIV/AIDS patients. The U.S. Food and Drug Administration has even approved the THC analog dronabinol for the treatment of nausea and loss of appetite due to cancer and HIV. In 1995, an early study of dronabinol as a treatment for AIDS-induced appetite loss was published, concluding that the nausea of patients improved by an average of 20%. The aforementioned patient study from 2005 showed that 93% of the HIV-positive cannabis users reported subjective improvement in nausea after smoking. In another study from 2005, it was discovered that HIV-positive patients with nausea were more likely to have cannabis users on their antiretroviral therapy than those who did not use cannabis. A patient who did not suffer from nausea did not clearly improve the therapy during cannabis use, indicating that the follow-up of the therapy was increased by improving the nausea symptoms. Mood improvement/antidepressant. Happy. Anxiety, depression, and mood disorders are common in HIV/AIDS and can be caused by a combination of negative physiological, psychological, and social pressure. The 2005 patient study showed that 93% of those surveyed relieved the anxiety after using cannabis, while 86% reported that their depression also decreased. In the aforementioned double-blind study from 2007 on cannabis and dronabinol, they discovered that both substances improved the mood of the respondents and caused a good drug effect, which increased feelings of friendliness, stimulation, and self-assurance. Interestingly enough, a low dose of THC seemed to induce more anxiety among the subjects than a high dose of THC or each dose. For analgesic. HIV/AIDS can cause severe and debilitating pain caused by various complex causes, including joint, nerve and muscle pain. A transverse 2011 study of 296 socioeconomically disadvantaged patients showed that 53.7% had severe pain, 38.1% average pain and 8.2% mild pain. More than half of the subjects had been prescribed an opioid painkiller. Higher pain also appeared to be associated with the occurrence of depression. In the 2005 patient study, cannabis use was found to ease muscle pain in 94% of those surveyed. 90% also reported improvement in neuropathy, nerve pain, and 85% in paresthesia, a burning, tingling and pricking feeling. The fact that cannabis can provide significant, subjective long-term relief from chronic pain in HIV/AIDS patients is something to remember. Safer and possibly cheaper drugs that could be used in disadvantaged groups instead of opiates may have multiple positive effects, including a decrease in opiate deaths and increased availability of medicines for those who need them. Induction of peripheral neuropathy. A specific and very common type of pain in HIV/AIDS is peripheral neuropathy, in which one or more nerves of the peripheral nervous system, i.e. every part of the nervous system outside the brain and spinal cord, are damaged and pain, nervous, paresthesia, muscle loss and affected coordination. It has been shown that the symptoms of peripheral neuropathy in HIV/AIDS and other disorders can be reduced by cannabis. In addition to the above-mentioned subjective reports of reduced nerve pain and paresthesia, various other studies have investigated the ability of cannabis to reduce peripheral neuropathy in HIV/AIDS patients. In 2007, a patient study was conducted in the U.S., Puerto Rico, Colombia and Taiwan, showing that 67 out of 450 patients with peripheral neuropathy reported cannabis use to improve their symptoms. A randomized placebo-controlled study, which was also published in 2007, found that in 52% of the group of cannabis users the pain was reduced by more than 30%, while in the control group it was only 24%. In addition, there were no serious side effects. The first joint that smoked a cannabis-using patient reduced chronic pain by an average of 72% compared to 15% in the placebo group. In 2009, in a double-blind, placebo-controlled crossover study into the efficacy of cannabis in the reduction of peripheral neuropathy, neuropathy was reduced by more than 30% of the 28 subjects in 46% of people from the cannabis use group. For 18% of the control group, and that the mood and overall functioning during the study improved to a similar extent.